Imagine losing 50 pounds without starving yourself. As a doctor, I've seen exactly how Ozempic changes lives. Confidence returns, energy skyrockets, and people feel in control for the very first time. In this video, I'll explain precisely how Ozempic works for weight loss, why it's so effective, and what you really need to know before starting. I'll even answer patients' most common real-life questions, like is it safe? How much weight can I lose? Do I have to take this forever? And what side effects should I expect? We'll even break it down into 6 key takeaways that everyone using or thinking about using Ozempic should know. Plus, I'll share with you what the first few weeks are really like and share practical tips to help you feel better, stay consistent, and set yourself up for long-term success. Hey, I'm Dr. Perry Lee. I'm triple board certified in obesity, emergency, and lifestyle medicine. I've also helped thousands of busy people make smarter health choices using easy, proven strategies that actually work. My goal is to help you lose weight, feel better, and perform at your best so you can live your best life. Before we begin, just a quick disclaimer. I am a doctor, but I'm not your personal doctor. This video is for general information only, and it doesn't replace medical advice. So please talk to your own doctor before making any major health decisions. The first key point is easy to miss, but it's the foundation for real, lasting results. This is especially true if you've tried willpower and it didn't work. Understanding how Ozempic works and why it's different from typical weight loss strategies is key. See, most people try to lose weight using willpower alone, but this usually leads to frustration, hunger, and burnout. Ozempic works with your body and not against it. It helps you feel full sooner and stay satisfied longer, so you can naturally eat less without obsessing over every bite. Ozempic, or semaglutide, mimics a natural gut hormone called GLP-1. This hormone helps you feel full, it slows down how fast your stomach empties, and it can reduce cravings, especially for snacks and sweets. Studies show that people using semaglutide lose about 10 to 15% of their body weight in 1 year. That's because it also acts on the part of the brain that controls hunger and satisfaction, so people are less likely to eat out of habit. You don't need a strict diet to see results, but you'll do even better with meals that include protein, fiber, and whole foods, which we'll discuss later. They help you feel satisfied and support steady, healthy weight loss. See, Ozempic is given once a week as an injection. It's usually done in the stomach or thigh. And most people start with a low dose and slowly increase it over time, which helps reduce side effects like nausea. You might not notice appetite changes in the first few weeks or two, and visible weight loss often starts after several weeks, depending on your dose, your body, and your habits. And if you ever miss a dose, no stress. You have up to 5 days to take it, but if more time has passed than that, then skip that dose and take your next one as scheduled. Please don't double up. Here's how to make it work best for you. Eat slowly and stop when you start to feel full. Focus on protein and fiber in your meals. Stick to the same injection day and time each week. Stay active. Light movement like walking helps your body adjust. And track how you're feeling, eating, and sleeping each week. The bottom line is this. Ozempic helps you eat less without feeling deprived. It mimics GLP-1, a natural hormone that helps you stay full, eat less, and digest more slowly, and even helps control your blood sugar through a weekly injection. But for the best results, I want you to think of it as an appetite reset, not appetite suppression. This next point might be the most important. It's the one that most people overlook. See, many people assume these medications are all the same, but the truth is knowing the difference between Ozempic, Wegovy, and Mounjaro can affect your results, side effects, and even how much you'll end up paying. These names aren't just different names on a box. They differ in how they work, what they're approved for, how they affect your body, and whether or not your insurance will cover them. Let's break it down. Ozempic and Wegovy both contain semaglutide, but they're approved for different things. Ozempic is FDA approved for type 2 diabetes, but doctors often prescribe it off-label for weight loss because research shows it can help people lose 10 to 15% of their body weight. To qualify, most people need a BMI of 30 or above, or a BMI of 27 or above if they have a weight-related condition like high blood pressure or sleep apnea. Wegovy, on the other hand, despite also being semaglutide, is FDA approved specifically for weight loss and comes in higher doses than Ozempic. If weight loss is your main goal, that makes it easier to get insurance coverage. Now, Mounjaro is different. It uses tirzepatide, which mimics 2 hormones, GLP-1, which we just talked about, and GIP. while semaglutide only mimics 1. That double action may help people lose even more weight. In one study, the SURMOUNT-1 study, people on Mounjaro lost between 15 and 21% of their body weight over 72 weeks. That's more than what we typically see with semaglutide, which is around 10 to 15%. And yes, you can switch medications, but talk to your doctor, especially if one isn't working well or causes too many side effects. One important thing to know, you don't need to have diabetes to use these medications for weight loss. Most people qualify with a BMI of 30 or higher, or again, a BMI of 27 and up with a health condition like high blood pressure, cholesterol issues, sleep apnea, PCOS, or joint pain. But qualifying isn't just about the number, it's also about how your weight affects your daily life, physically, emotionally, and mentally. So talk to your doctor about how you feel, the fatigue, the joint pain, poor sleep, or even stress about your weight. It all matters. Now let's talk about cost, because it's the most significant barrier for most people. Now without insurance, brand name medications like Ozempic, Wegovy, or Mounjaro can cost upwards of $800 to $1,000 a month. If that's too steep, ask your doctor about compounded versions. So although they're not FDA approved, they can cost 50 to 70% less, and the quality can vary depending on the pharmacy and state laws. Make sure the compounding pharmacy is licensed and reputable, and your doctor can help you with that. If you're thinking about starting one of these medications, here's what to do. Talk to your doctor about your weight loss goals, health history, and which medication you're eligible for. Check your insurance coverage in advance. See, approval and pricing can vary widely. Track your progress to see how your body is responding to these medications, and switching might be the right move if you've hit a plateau or have significant side effects. And finally, be honest about your budget and symptoms. Mounjaro may be better tolerated for some, while compounded options offer more affordability. At the end of the day, here's what really matters. Ozempic and Wegovy both use semaglutide, but only Wegovy is FDA approved for weight loss. Thanks to its dual hormonal effect, Mounjaro might help you lose even more. The best choice really depends on your body, your goals, and how you feel on the medication. So work with your doctor, know your options, and choose the path that sets you up for success. This next part might surprise you, and it could save you from giving up too early. One big reason people get discouraged on Ozempic is that the progress feels slow. If you're not losing weight right away, it doesn't mean the medications aren't working. Your body may still be adjusting. Knowing this upfront helps you stay focused. With Ozempic, success comes from consistency and patience, not speed. As mentioned earlier, in clinical trials, people taking semaglutide, that's Ozempic or Wegovy, lost about 10 to 15% of their body weight over 68 weeks. That's a significant result, but it doesn't happen overnight. Some people lose weight in their first month, others may not see progress for 2 or even 3 months, and that's normal. See, these medications work gradually. It curbs your appetite, it slows digestion, and it changes your brain's reaction to food. So, if the scale hasn't moved yet, that's okay. Focus on some non-scale victories, like, are you getting full faster? Are you craving less snacks? Are you eating smaller portions without feeling deprived? These are all signs that they're working, even if the pounds haven't dropped yet. And yes, plateaus are normal too. If progress stalls, your provider may adjust your dose or help fine-tune your habits. Don't panic. Keep going. Once the medications kick in, most people lose 1 to 3 pounds per week. But here's the key. Ozempic isn't magic, it's a tool. The habits you build, like eating better, sleeping more, and moving regularly, makes the results last. In fact, studies show that if you stop Ozempic without building those healthy habits, the weight often comes back. That's why now is the time to reset your routine and work with your doctor on a long-term plan. Here are a few tips that can help. Track your non-scale wins, like better energy or fewer cravings. Take weekly photos or journal how you feel. Eat regular meals, especially containing protein and fiber. Move your body every single day. Even 10 minutes helps and adds up. Weigh yourself weekly and not daily to see clearer trends without stressing over daily changes. And check in with your provider if you're unsure how it's going. They can help you adjust your plan. If you take one thing away, let it be this. Ozempic isn't a quick fix. It's a long-term strategy and support tool that works best when combined with healthy, sustainable habits like mindful eating, better sleep, and regular movement. Everyone's journey looks different, but people lose 10 to 15% of body weight over a year on average. But the real win? Building a healthier lifestyle that lasts long after the medications end. One of the biggest reasons people stop making progress on Ozempic isn't that it doesn't work, it's that it has side effects. So even when the medication is helping with weight loss, symptoms like nausea, bloating, and constipation can make you wonder if it's worth continuing. But here's the truth. Most of these side effects are temporary, and with the right strategies, they can be managed, so you don't have to give up too soon. As mentioned earlier, Ozempic or semaglutide works by mimicking a natural hormone in your body called GLP-1. This hormone helps you feel full, slows digestion, and reduces appetite. These effects are exactly why it's so effective for weight loss, but they're also why people feel sick at the start. The most common side effects, especially during the first 2 to 4 weeks, are digestive. You get nausea, gas, bloating, constipation, heartburn, loss of appetite, and sometimes fatigue. In the sustained clinical trials, 20 to 44% of people reported nausea early on. Still, fewer than 5% stopped taking the medications because of it. That tells us two important things. The side effects are real, but usually get better. And more importantly, most people stick with it and succeed. Symptoms often improve over time, but if they're too intense, it could mean your dose is increasing too quickly. Your doctor can help slow things down or recommend simple tools like anti-nausea medications, stool softeners, or fiber supplements. Just make sure to check with your provider before adding anything new. If you're feeling too sick to eat, the focus should shift to hydration and gentle nourishment. Stick with small, bland meals like broth, toast, bananas, or protein shakes to give your body what it needs without making things worse. And remember, don't stop Ozempic on your own. Often, a small adjustment or just a little bit more time is all it takes to feel better and keep seeing results. Here are some practical tips that can really help. Start low and go slow. Let your body adjust gradually to each new dose. Eat smaller meals and slow down while eating, and try stopping when you're about 70 to 80% full. Avoid greasy or heavy foods at first. They're harder to digest and can worsen nausea. Stay hydrated and increase fiber to help prevent bloating and constipation. Stick to your injection schedule, same day, same time, every week. And if you're feeling off, keep it bland. Crackers, broth, toast, they can all help settle your stomach. So here's the main point to remember. The most common side effects are nausea, bloating, gas, and constipation, especially in the first few weeks. But with the proper support, a slow dose increase, and healthy eating habits, most people feel better over time and keep progressing. This next point is one of the most common questions, but it usually arises after someone has already started the medication. Many people want to know if it's safe to stay on Ozempic long term, and what really happens if they do. It's a smart question because while medications like Ozempic can be very effective in the short term, the ultimate goal is long-term health, strength, and disease prevention. Regarding Ozempic, the injection is just one part of the story. If you're not also taking care of your nutrition, your muscle mass, and movement, you might lose weight but feel weaker. That's why what you do outside of the injection matters as much as taking the medication itself. Clinical trials like the SUSTAIN 6 trial has shown that semaglutide, the active ingredient in Ozempic, is generally safe for long-term use when prescribed and monitored by a doctor. In fact, it's been shown to reduce the risk of cardiovascular events in people with obesity or type 2 diabetes. But here's something important to understand. The most significant safety concern isn't the medication, it's the type of weight people lose. Research suggests that 30 to 40% of weight loss on semaglutide may come from muscle instead of fat if you're not actively working to maintain lean muscle mass. Some people stay on Ozempic long term, just like they would with blood pressure or cholesterol meds. Others eventually stop with their doctor's guidance after building strong, sustainable habits. What's important is that you don't suddenly stop. Rapid weight regain is common, not because Ozempic didn't work, but because the habits needed to maintain the results weren't in place when the medication stopped. When monitored by a doctor, Ozempic is also considered safe for the heart, kidney, and liver. Again, the real risk isn't the drug itself. It's losing too much muscle or skipping out on essential habits like movement, sleep, and nutrition. That's why it's so important to take a whole body approach. Another version of the same question is, do I have to take Ozempic forever? The honest answer is, it depends. You don't have to stay on it forever. Many people actually taper off after reaching a healthy weight, building good routines, and feeling confident that they can maintain their own progress. Others switch to a lower dose or even a different medication. And some will continue using it long term, just like they would for any chronic condition. The key is making that decision with your doctor based on your goals, lifestyle, and medical needs. What you shouldn't do is stop too early, before your habits are strong enough to support your results. That's because once you start taking Ozempic, your hunger hormones return to baseline. If you haven't locked in your habits around food, movement, sleep, and stress, old patterns often return, and so does the weight. Research backs this up. In the Step 4 trial, people who stopped semaglutide regained about 2/3 of their weight they had lost within 1 year. That's not because the drug failed, it's because the drug helps support your biology while you build healthier habits. Once it's gone, the habits have to carry the load. So if you're thinking about coming off Ozempic, make sure your foundation is solid. While you're still on the medications, use that time to build the routines that will help you maintain your results long term. Here are a few ways to make Ozempic safer, more effective, and easier to taper off when the time comes. Eat enough protein. Aim for 20 to 30 grams per meal to protect your muscle mass. Strength train 2 to 3 times a week. Walking is excellent, but lifting weights or doing body exercises helps keep your body strong. Track how you feel. If you're losing energy or strength, you might lose muscle, not just fat. Focus on habits. Build consistent routines around food, hydration, sleep, and movement. Stay in touch with your doctor. Don't stop without a plan. If you're ready, work with your provider on a gradual taper. Use this time wisely. While your appetite is reduced, it's easier to build routines that stick. Those habits are what keeps the weight off, not the medications alone. And finally, stay open. It may be worth continuing if the medications helps you stay healthy and prevents disease. Talk to your doctor about this. To put it simply, Ozempic is safe for most people in the long term, but lasting success doesn't come from the injections alone. It comes from the habits you build while on it. You don't have to stay on Ozempic forever, but if you stop too soon, before your routines and habits are strong, there's a good chance the weight will return. Let Ozempic support your change, but remember, you are the one who sustains it. This next part might surprise you, but before we talk about that, you're here watching this video because you have a goal, whether that's to lose weight, feel better, or have more energy. And what's the fastest way to get there? By following a simple plan that actually works. That's exactly why I created the 7-Day Health Reset. It's a free guided program where I'll text you one simple habit to focus on every week, plus a quick daily nudge to help you stay consistent and feel better naturally. There's no apps, no logins, no pressure. Just easy, science-backed tips to boost your energy, digestion, and mood in under 2 minutes a day. Spots are limited each week, so tap the link in the description to join me and get step-by-step support sent straight to your phone. Now, this next point is often overlooked, but it's one of the most important and can drive the biggest results. When you're on Ozempic, focusing on protein, fiber, and real whole foods can make a huge difference. These choices help you feel full with smaller portions, support fat loss, and may even reduce side effects. Staying active with regular movement also plays a role. Exercise not only supports weight loss, but can also ease common issues like constipation. And while a little alcohol is usually okay, it's always best to avoid it. What and how you eat while on Ozempic can shape your entire experience. One of the biggest mistakes people make is thinking they can eat the same way they did before. But Ozempic slows digestion and changes how your body processes food. Suppose you don't adjust your eating habits. In that case, you may run into more side effects like nausea, bloating, or constipation, and possibly miss out on the full benefits. Ozempic or semaglutide naturally helps people eat less, but your food choices still matter. Protein and fiber are beneficial. They stabilize blood sugar, keeps you satisfied longer, and helps protect your muscles as you lose fat. On the other hand, greasy or fatty meals can make nausea worse, and slow digestion even more. Alcohol isn't totally off limits, but it can irritate your stomach, especially in the early weeks. So you don't need to follow a strict or complicated diet. A high protein, high fiber approach works best. You can still eat carbs and even enjoy sweets in moderation. Just try to pair them with protein or fiber to avoid blood sugar spikes and reduce cravings. Most people find that their appetite naturally decreases while taking Ozempic, so portion control becomes easier. The key is to listen to your body's signals, and because digestion slows down, large or heavy meals can trigger side effects. Eating smaller, balanced meals throughout the day usually feels and works better. So here are a few ways to make these changes simple and effective. Include a source of protein at every meal, like eggs, Greek yogurt, chicken, tofu, or fish. Add fiber-rich foods like vegetables, lentils, oats, berries, and beans. Eat slowly and stop when you feel 70 to 80% full. Your body needs time to catch up. Avoid fried, greasy foods, especially in the first few weeks. Stay active. Aim to walk daily and do strength training 2 to 3 times a week to protect your muscles. And if you do drink alcohol, limit it and watch for stomach symptoms like nausea or reflux. These strategies work with the medication, not against it. They help you stay energized, reduce side effects, and lose more fat while protecting your muscles. So here's the bottom line. What you eat on Ozempic matters more than most people think. Prioritizing fiber, protein, and whole foods, and staying active can help you feel full with smaller portions, reduce side effects, and maintain your progress. When you combine smart habits with medical guidance from your doctor, you'll get the most out of your journey. So we've discussed some of the most common questions about Ozempic and simple, powerful ways to maximize your results by using it. But there's one more thing we haven't discussed yet, and it might be why you've struggled to lose weight for the longest time. Because, let's face it, it's your unhealthy habits that are holding you back. That's why I made a video showing you easy ways to stop unhealthy habits for good, even when you're tired, stressed, or not feeling. Click this next video to learn 6 simple steps you can use right now to break your unhealthy habits for good.